Well, in this section of the lecture, we're going to shift our topic from what we can do in the office to what advice can we give to our patients to help them accomplish things at home to prevent disease. We only going to see them, at the most every 3 months, see them 4 times in a year for preventive services, but they're going to be but they will be seen every day by their caregivers. And so real prevention is going to occur um, when they are at home. Brushing and flossing are often one of the biggest challenges. So we will begin our talk looking at some of the options that are available to help patients be able to do a better job brushing at home. I think we've shown you this in some other lectures, but it's worth showing again that this particular toothbrush, the Surround toothbrush, is a great product. Specialized Care company produces this product, and you can see that it actually has 3 separate bristles so that it can grab both sides of the tooth and the occlusal surface of the tooth all at the same time. And so it speeds up the brushing process. This is not going to brush as efficiently or as well as what you would get out of a regular toothbrush. Okay, so if you have the ability to use a regular toothbrush, then use a regular toothbrush. But for patients that have very limited amount of time that they can tolerate having their teeth brushed, then this becomes a good option for people to purchase. And they can get it from Amazon, and they can actually get it directly from Specialized Care company. So this is a product for a patient that you need to do a fast brushing. You only have a limited amount of time. For other patients, they may have more of the issue of just dexterity. They lack the ability to grip the toothbrush, or they can't maybe bend their arm sufficiently. And so modifying a toothbrush can be helpful. And here you see a number of different types of modifications, from taking a piece of foam and putting around the handle. This one I love, and that's just putting right through a tennis ball. This is very simple, a washcloth with rubber bands around the handle. And these 3 are all options for someone who can't grip as tightly, gives them a fatter handle. I have seen some dentists actually use acrylic and fabricate a custom handle. Another, more than acrylic, sometimes the firm body impression material that you may use in the clinic can be shaped also into a handle that can go around a toothbrush. And I think the biggest challenge with something like that is not wanting to have to do something that has to be thrown away. Now, this last example of this is taking tongue blade and attaching it onto the end of a toothbrush handle. And what this is doing is giving a longer reach. If you have a patient that lacks the ability to bend their arm as much to get up into the mouth, then this type of modification can really help. So these modifications, again, are for a patient that cognitively has the ability to brush their own teeth, but physically is challenged. This type of option is more for a patient that cognitively and cooperation-wise can't really do as good. They're not able to brush their own teeth, and someone's needing to brush for them. Flossing becomes another very important aspect of daily care. And I am a fan of this particular flosser. Any of them can work, but this flosser, the floss comes off at a 90-degree angle to the handle. So this shape allows families to be able to reach to the back teeth much more easily. I use this myself, but also if you think about trying to floss someone else, if you were standing and trying to do hygiene for someone, this becomes a much easier way to reach those back teeth. But one of our biggest jobs is trying to teach caregivers how to do the job. And, family members or caregivers will all kind of struggle. And a lot of times it's a struggle with how to position the patient, particularly if you're dealing with a patient that is not going to be perfectly cooperative. So the first example I'm going to give you is for a patient that is more cooperative. And this is just teaching the caregiver to stand directly in front of the patient and use the toothbrush to reach all teeth. And one thing I want to point out here in this example, we are actually using a Sonicare toothbrush. I do think that electric toothbrushes can be better choices for a lot of my patients. And the sonic toothbrushes sometimes can even be the best choice, because sometimes that vibration, for some sensory patients, that vibration is actually comforting to them. For others, it may not be. There's not a one-size-fits-all recommendation. And so there's some experimenting that has to be done. I should mention that I'm a little more cautious about what's called a spin brush. Those are the electric toothbrushes that have a round head that just spins. And sometimes the head on those is so big, it becomes difficult to get into all of the teeth. So the Sonicare typically has a much smaller, more toothbrush head that's more typical to a regular manual toothbrush. But again, this is good for better patients that aren't going to necessarily reach out and want to grab you with their hands. It's also probably the position that has the lowest risk for gag reflex, because the patient's standing and can even lean forward a little bit if they're struggling a little bit with gag reflex. I'm positioned to more easily come in and out of the mouth in this position. Now, if I've got a patient that I'm struggling to get to them, maybe they're really tall. We had a 6'5" patient yesterday in the clinic. If they're really tall and I can't get up to them, then sometimes sitting and standing behind can be helpful. It's also good if I've got a patient that may be wanting to move their head or is struggling to hold their head still because of some involuntary movement. Then this becomes good as you have the patient sit, lean their head back into the caregiver's arm, and then come around and brush. With my left arm here, I can help control the head if I need to, and I'm able to come in and brush from this direction. Now, this increases my gag reflex tendency just a little bit, because you can see, the brushing liquids would be falling backwards a little bit more. So I have to be a little more cautious about gag reflex in this position. A recliner is another good option. Just have them sit in the recliner all the way back, and go behind them and brush from this position. Now, this is actually a helpful training option as well, because it more resembles what the patient will experience when they come to the clinic. So if I've got a patient that I'm trying to desensitize, trying to get them used to being in a dental chair, leaning back, having someone coming over them from this position here, having the parents model this at home in a recliner can actually be a really positive thing to get them more used to this happening. We are even more, though, increasing our risk of gag reflex because we're leaning further and further back. And so now things are coming down even more. I can have a patient lay in the bed. Now, this is good for patients that are more physically incapacitated and you don't have, maybe they can't stand and moving them into chairs is not as easily done. having them lay down in the bed can be helpful. And then sometimes for a patient that's a little bit less cooperative, laying in the bed can be helpful because, as you can see with my hand here, I've got a little bit of control. You could even have somebody sitting in the bed with you to help hold hands in this position as well. This is going to be probably my highest gag reflex, but it's so I have to be careful about that. And if I've got some real sensitivity, I may need them to turn their head to the side. But laying in the bed can be another very good option at home. The final option is a two-person option where the patient is laying on the floor. They're able to put their head into the lap of the caregiver, and the caregiver number one can actually reach down also and hold the hands. Often putting the hands in a crisscross fashion like this is easier to control than trying to keep them straight. So the crisscross is an important thing. And then the second caregiver can come in and actually do the brushing. So these are the different positions that you can help coach someone through, and some modifications for things that they can do at home. But we don't have to just do that. There are medications that we can recommend that they use at home and apply that can equally help prevent. So I want to go over a few of those as we wrap up. Fluorides in the office are very important, but fluorides at home need to be considered as well. If you're going to do supplemental fluoride, please don't prescribe it to anyone who's under 8 years of age, because a lot of times, whether it's typically developed patient or a special needs patient, there's a good likelihood they're going to swallow a good bit of the fluoride. And if we swallow too much of it and we still have developing teeth, then we can get fluorosis. Okay, so we want to limit take-home fluorides till at least 8 years of age and older. Very rarely are they going to be able to use custom trays. So for your typically developed population, you may learn how to fabricate a custom tray that the patient would wear for at-home fluoride. Not really an option here. Very few patients also can rinse and spit. So having them swish with something for 30 to 60 seconds like you would in a typically developed population, that's not very often going to be very real. So very often we're having to take whatever we put on and apply it with a toothbrush or something of that nature. And you need to consider the amount of contact time that's required for efficacy. If I've got a patient that is only going to be able to tolerate someone in their mouth for about 5 to 10 seconds, but I've got a fluoride that needs 30 to 60 seconds of contact time, we're not going to have any efficacy there. There's no point in even applying it. So you've got to consider those things. Now, what are my options? We mentioned earlier, the top one here, we mentioned the Preventive 5000. Preventive 5000 is a high fluoride toothpaste. The advantage of this is patients are going to be using toothpaste anyway. So instead of using a regular toothpaste, you will give them a prescription for this. They use this on the toothbrush and apply it. It is a sodium fluoride that is in the toothpaste. Now, a lot of times what I will recommend with this, and this isn't on the slide, but I will recommend that the patients apply this with the toothbrush to all the teeth at night before they go to bed. Get rid of the excess. If they can spit it out, great. If they can't spit it out, wipe out the excess. And then go to bed without rinsing. And that would allow that to sit on the teeth all night while they're sleeping. So apply it at night with the toothbrush, spit or wipe out the excess, and then go right to bed without rinsing. That's my typical recommendation for Preventive. Gel Cam is very similar, and it is if perhaps the patient has a toothpaste that they're already using that they like, but you want to supplement with a second fluoride. This is just fluoride, where Preventive has toothpaste plus fluoride, Gelcam is just fluoride, but you would apply it pretty much the same way. Now, MI paste has become increasingly popular. MI paste itself, just plain MI paste that doesn't have the plus on there, is a calcium and phosphate rich media that is supposed to help with remineralization of new caries. Evidence on that is a little bit lacking, but that's the intent of it. But MI Paste Plus goes ahead and adds fluoride, and that's very important. This is the product. I wouldn't really consider using MI Paste, but I would consider using MI Paste Plus because of the fluoride. And it has multiple different flavors that could be chosen from. It is a very similar type of product. In terms of application, I'm going to apply it very similarly to the way that we talked about applying the Preventive 5000. So exact same thing. Now, if we have a patient that can rinse, does use a mouthwash. We had a patient like this actually yesterday. We had an autistic patient that, actually this was the 6'5" patient that I mentioned earlier, but he actually uses a Listerine mouthwash all the time. So we recommended to the family, let me say this. He used Listerine mouthwash, but was really resistant to toothpaste. So we told the parent, brush the teeth without toothpaste. Just don't use the toothpaste. But then we switched him from a regular Listerine to there is another Listerine that actually has fluoride in it. And so we recommended that she switch to the Listerine with the fluoride in it, or we could have switched her to something like, ACT is the brand here that's on the screen. But any of the mouthwashes that actually have fluoride, you could get them to rinse with that. Now, I mentioned earlier that a lot of our patients are not going to be able to rinse and spit. This particular patient was the exception. But if for a patient that can't rinse and spit, then these little toothettes can be a nice adjunct. A lot of times a toothbrush is simple, but if you can dispense these little toothettes, they're basically a little sponge on a stick, and they can soak up the mouthwash and apply it to all the tooth surfaces. But you've got to coach the families to repeatedly apply for 30 to 60 seconds, because most of these are not going to have any efficacy if we just apply them for 10, 15 seconds and no longer do any more. So our final topic for this lecture is going to be dietary considerations. And this may be one of the most important apologize for the alarms going off. Let me go back. Dietary considerations may be one of the most important preventive measures that we have available to us. So let me move forward. For a lot of our patients, good oral hygiene may not be realistic. I've spent a lot of time talking about different ways to train people at home to do good oral hygiene, but I have numerous families that they just look at me and it's just not real. They're not going to be able to do it. So the one factor that those families may have is they can control what's available to go in the patient's mouth. So if they can't do good hygiene, then controlling sugars is really important. And the big sugar that has to be controlled the most are sugar sweetened beverages, SSBs, is the way you'll see it in the literature, okay? But SSBs are really both on the pediatric and the special needs side of my practice, they are what create most of my business. And they bathe all the teeth in a sugar, so it reaches all nooks and crannies. And very often they're consumed over long periods of time. So, I've had a special needs patient that was in a wheelchair that was cognitively almost normal. But on her wheelchair, they had a little area that would hold a Coke, and she had a straw, and she could lean forward and just sip on her Coke all day long. And we had tremendous amounts of decay that we had to fix for her. And she was a great person, but her gag reflex was terrible. And it was really difficult to get her teeth fixed. So being able to control this aspect is critically important. A good diagnostic question across the board is, in a typical day, what do you drink the most, or what does the patient drink the most? Okay, in a typical day, what do they drink the most? That is the question that typically will help me out the most. Okay. Now, as much as this is really important, I often find families really resistant to the diet control. We'll have families that actually will view that the SSB is their special treat, and they kind of see it sometimes as the patient has so many things going against them. Can't they at least have this one special thing? And taking it away, particularly for someone on the autistic spectrum or with greater intellectual disabilities, sometimes that can create a just meltdown that families don't want to have to deal with. And so don't take it for granted that this is an easy recommendation for them to accept. Sometimes it's going to take some coaching on our part to get them to understand the importance. I have had a family, I've had actually more than one family, but I've had one in particular I can think of that absolutely chose Dr. Pepper over the teeth. They looked at me and they said, there's no way that we're going to get Dr. Pepper out of the patient's mouth. There's no way we're going to switch to something that doesn't have sugar in it. So just go ahead and have all the teeth taken out. And difficult for me to fully understand that, but they were at least being realistic that this was not a change they were going to be able to make. Now, ideally, what are our best options? Ideally, water, milk, unsweet tea. These are good choices. Water, of course, has no ability to cause tooth decay. It's healthy for us. It hydrates us. It's great. Milk, very little cavity causing ability. And really, even some studies would indicate milk is cavity preventing. Just don't put chocolate in it. Don't put strawberry in it. As soon as we do that, then it's no longer cavity preventing. Unsweet tea shouldn't be a cavity causing issue, but we got to be careful with it from a stain standpoint. But we can get stain off teeth. And I'm not, if this can be viewed as a treat, great. Of course, as soon as we start sweetening it, now it becomes a problem. Just like if we put chocolate in the milk. Now notice that I don't have juice on this list. And it may be 100% natural. May have a lot of families that really want that. They think 100% natural, organic, all of that. Juice is not natural or organic. I guess it is organic, but it's not. You don't go and stick a straw into a running natural spring of apple juice. And it is not natural for any human being to sit down and eat 5 to 10 apples at a time. And when you drink a glass of apple juice, that's essentially what you're doing. So this, of course, is not a natural option. Now, artificial sweeteners can be very helpful in providing that treat, that special occasion thing that the families are wanting to not take, anything particularly that tastes good away from the patient, but can allow them then to do it in a way that's not going to harm the teeth. Crystal Light and a lot of variants on this, not just this product in specific, but there's a lot now of competitor products. Real Lemonade's one of them, and I think Walmart has its own brand of sugar-free drink mixes, and these can be really nice. And they also don't have the carbonation that carbonated beverages would, so you're not dealing with quite as much of an acid issue. Of course, Diet Coke and Coke Zero, these are equally going to be sugar-free. You've just got a little bit of an erosion risk with them. And then you've got your artificial sweeteners themselves like Splenda and Stevia. We love Splenda for making pitchers of sweet tea. It tastes sweet, tastes wonderful, but it doesn't have the calorie issue. I teach parents to learn how to look on the label. Okay, and what I'm doing is I'm looking at calorie count on the label. So here you see on a regular Coke that the calorie count is 110. But if I go down to my Coke Zero Sugar, then my calorie count is 0. And so that if I've got a serving calorie count that's 10 or less, then I typically am in a safe range from a cavity standpoint. If you look at Dr. Pepper 10, it is 10 because it has 10 calories. And so some of the drink packets and a few of the drinks will actually be in that 10 calorie range, but these tend to be safe things. Now, there is some debate on, are artificial sweeteners a risk? Are they a bad thing? So, I mentioned earlier that you've got some families, particularly some of the families within the autism group, that are really committed to all natural and organic. Okay. Now, if they're committed to all natural and organic, you would think that we wouldn't have to be worrying about soft drinks because those are not natural or organic. So maybe that will already be taken care of. Almost all of your sugar sweetened beverages are sweetened with high fructose corn syrup. So they're not even sweetened with sucrose. And there's a little bit of evidence that sucrose may be a little bit better overall in health than high fructose corn syrup is in terms of the way it's metabolized. High fructose corn syrup has some metabolic pathways that sometimes there is some question about them. Okay, but if you want to look at artificial sweeteners and are they a problem, I've provided you a link on the homepage of the Canvas site to this article here. Is Coke Zero bad for you? Now, this is a lay article. Okay, it's not a peer-reviewed article, but I think it puts into good language some good common sense thinking on artificial sweeteners. And so I encourage you to click on the link and look it over. It's just a single web page. But aspartame, which we kind of think of as NutraSweet. This is the most common sweetener that is used in our soft drinks. Okay, the FDA has an accepted daily intake of about 50 milligrams per kilogram per day or less. So it'll be acceptable to intake up to 50 milligrams per kilogram. Now, if you translate that into actual drinks, it would mean that the average adult would have to drink 19 cans or 6.7 liters of Coke Zero in a day. If they can do that, then we need to be cautioning them about not drinking quite so much of it. Honestly, if we're at that level, we've got an erosion risk for the teeth. But I can't imagine anybody is anywhere. I can't imagine anyone even doing a third of that. And so the levels are not at risk. So my recommendations for these situations are that families should talk with their primary care providers about artificial sweeteners. I just tell them, that's not my area of expertise when it comes to the overall physical issue. And from a tooth perspective, I like them a lot from an oral health perspective. But if they've got concerns, talk with their primary care provider. Day to day, use artificial sweeteners instead of sugar sweetened beverages. Use them for your regular day-to-day thing so that, we want something that tastes a little better than just water. But, try to limit their artificial sweetener to just 2 or 3 times a day. But then my recommendation is on special occasions, have a special occasion. On special occasions, go for it. Don't feel like that you've got to be careful and that they can't have something. I'm a dentist says on Halloween, go have Halloween. The next 2 weeks eating on the candy, that's where the problem is, right? So day to day, use the artificial sweeteners. So that would finish up kind of the recommendations for folks at home and what they would need to do to try to prevent disease in their child. The final section of this lecture will have a brief wrap-up statement to finish everything off. We'll see you at that.